I'm joined now by Dr. Richard Besser, former acting director of the CDC. He's now president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, thank you so much for joining me today. I really appreciate it.
Thank you, Kristen. It's great to be here.
Well, if you can, it's great to have you here. Help give some context to part of the conversation you just heard from President-elect Trump. He talks about the fact that the rates of autism have increased over the past quarter of a century. I made the point that that is because scientists say they've gotten better at identifying it. Can you give us more context, though?
Yeah, I mean, first, let's make sure we're talking about the right numbers. So in the year 2000, the rate of autism was 1 in 150 children, not 1 in 100,000. And the most recent data says that the rate of autism is 1 in 36 children. So it is on the rise. And the question that you put to him, and then you shed some light on, a lot of this has to do with how autism is diagnosed. This isn't a condition where there's a blood test or an X-ray and you say, okay, this child has autism. There are criteria for that. And over time, the ability to diagnose and identify children who are on the autism spectrum has improved. And in many states, there are services that are tied to that diagnosis. And so you've seen some increase with that as well. But I do think it is important to do research to understand rates of autism and the rise in autism. But I think it's absolutely cruel to lift up time and time again the false conjecture that these rates of autism have anything to do with vaccines. In the year 2004, the Institute of Medicine, which is an independent body, looked at this over the course of more than a year, analyzed all the hundreds of studies, and concluded there's absolutely no connection between vaccines and autism. And I practiced pediatrics for more than 30 years. I can tell you there's nothing that I did for my patients that has more proven value than making sure they were vaccinated fully and on time. And to keep putting into parents' minds this idea that, well, if they vaccinate their children, it could cause autism is absolutely cruel. And it takes the resources that could go around finding better treatments and better ways of diagnosing autism away from because they're going into an area that's already been settled.
Dr. Besser, you heard President-elect Trump say two things. One, that if RFK Jr. is confirmed, that he should look into childhood vaccines. He also said he's not going to upset any system. What did you make of his comments, and should there be any type of, is there a kind of a hard look being taken at childhood vaccines broadly, not because of the concerns that the president-elect raises, but in general to make sure that they continue to be up to date?
Yeah, we have one of the best vaccine approval systems in the world. And so the efforts that are undertaken before any vaccine is approved for use in children or adults is incredible. And then for CDC to then review that, independent advisory committee makes the recommendation as to whether they should be used. And so, to have someone in the position as Secretary of Health and Human Services who has done more than just about anyone to undermine the confidence that parents can have in vaccination is really frightening. There are so many talented people who could be in that role, who could truly advance health in America. To have someone who is just continues to put up these theories that have already been disproven means that we will not advance in the ways that we could around other health issues.
He did talk about the fact that he also wants RFK Jr. to focus on trying to bring down drug prices. You heard the president-elect say he'd been in touch with pharmaceutical companies. Is that something that the HHS Secretary has the authority to impact? How does that work, and what do you make of that aspect of what we heard from the president-elect?
Yeah, I think that's great. We have a real issue in America with drug prices, where drugs here cost a lot more than they do in other wealthy nations. There is the opportunity to impact on that. One of the other areas that the department is responsible for is the Center for Medicare, Medicaid Services. There's been a lot of efforts over the years to try and allow Medicare to negotiate drug prices. That's very helpful. So having a secretary who's interested in that is terrific. The idea that we would have to accept someone who is pushing back on vaccines in order to get that is challenging. And there are a number of things that Mr. Kennedy has lifted up that are important issues for us to address. But I really worry about having that microphone there and being able to discredit vaccines, even though most of those recommendations come from the state. Yeah. Having the disinformation, the falsehoods coming from the federal government will undermine people's confidence.
Dr. Richard Besser, thank you so much for being here. We really appreciate it.
Thank you, Kristen.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.